I want to make sure you're in the right meeting space. This is the Community Health Response Corps RFP 10556. So hope you're in the right spot. And Brian, can you record?
Yeah.
So we are going to record this for those of you who want to go back and watch it or who can't be here today. So let's go over what's going to happen today. So it's going to be about 1 hour in length. I'm going to go a very quick high-level overview of the RFP, and then we'll have time for questions and answers. And if we can't get you all the answers today, there will be a fact sheet that will be sent out that will provide those answers for you. So just to let you know, what is the purpose of the RFP? So the Chicago Department of Public Health wants to work with community-based organizations to employ community health workers to lower the life expectancy in certain areas in Chicago. So how are we going to do this? So we want to promote the overall health and well-being of folks in that area and provide access to services and resources in those areas, including both physical and mental health opportunities. So let me tell you a little bit about this Community Health Response Corps. So it started back in 2020 in response to COVID, and we kind of very quickly organized, several community-based organizations to meet the COVID-19 needs. So that was contact tracers, and then it turned into vaccine ambassadors. So that Corps was very purposeful in getting the message out to the community. So we thought, why not sustain that and talk about more resources in the community and how to better help folks live healthier lives in the community. So that's what we're here today to do.
The slides are advancing.
Oh, can you guys see my slides advancing?
I don't believe so.
No, they're not moving.
Oh, thank you for letting me know that. Okay, so one moment, please. I'm going to stop sharing.
It might still be on the title page.
If you close the comments, worst case scenario, we can just go through with the whole deck open. Not in presentation mode though.
Okay. So I started from here. That one. Oh no, that's not gonna work.
Yeah. You
Okay.
need to reshare first again.
Yep. I'm sorry, folks. Okay. Can everyone see my screen?
Yes.
Okay. Okay.
Yeah,
All
now
right.
we're on the background slide.
Okay, so these will
You may
all be
wanna-
on.
Kate, you may want to go back to the slides because I think we need to show the slides that you were reading. I think we should at least show them. Thank you for the purpose of the recording.
Sure, thank you. Okay, so what we're here today to do is I'm going to give it a high-level overview of what the RFP is about, and then there'll be time at the end for questions and answers. Please put all of your questions in the chat. We will take all of these questions and we will record these, and they will be posted on the website, so everybody has access to these questions as well as answers. The purpose. So what we're trying to do is we want to work with community-based organizations to employ community health workers to help lower the life expectancy gaps in certain neighborhoods in Chicago. So how are we going to do this? We want to promote the resources available to folks in these communities and to really promote overall health and well-being. And we're going to do that with both your physical and mental health. Okay. So the background. Back in 2020, when COVID hit, we were able to organize over 30 community-based organizations to employ community health workers. So people who live in the communities that they're serving to do contact tracing work. And then once the vaccine came out, they became vaccine ambassadors. But this was a great way, these community health workers and this response corps was a great way to get information out and resources out into the community. So we're here today to continue that good work and to promote mental health services, physical health services, in general, just overall health, and connect people to the resources in the city. So mental health, right? We all have it, and it is really important, and it directly relates to how we manage the stress in our lives. So how everyone manages their mental health is different, and there's no cookie cutter approach to how people manage their mental health. But however, the city of Chicago has a variety of ways where you can reach out and access mental health services. So what these community health workers are here to do is to learn about those services and provide access to those services to the people out in the community. So how are we going to go about doing that? So the city has some guiding principles. We want to make sure that we are actively working to reframe and dismantle the system of perpetuating privilege. So we want to make sure that everyone has access to these programs. Trauma prevention and trauma-informed services. We want to make sure that this is healing and people should be informed about all of the services and preventions offered. We want to make sure the messages we're sending out in the community are reflective of that community and people understand the resources that we're trying to point them to and how to help them live healthier lives. And we want it to be equitable, right? We want to have everyone in any community have the same access no matter where you live. So these are the guiding principles which your proposal should be written. How do you access this RFP? So I wish I could say it was a one-click step and it was very easy, but some of you have experienced that it's not so easy. So there is no hard copy, paper copy of this RFP. The only way to access it is to go through our procurement website. So the website is here in this PowerPoint. So I just wanted to give a couple slides on how you access it because it's not the easiest thing to find. So when you get onto the procurement website, you'll see all the RFPs for the city of Chicago. So you're going to want to scroll down to make sure you see the one for the Chicago Department of Public Health where it says Community Health Response for. So that's circled in red there on your screen. The next thing, all the way at the end, it looks like little eyeglasses that are very, very small. That is where you're going to click on that where you'll actually get the RFP. So then this is what will happen. You'll get the screen and it will say the name of the RFP and the number. And then all the way up in the top here, circled in red, is how you can actually download the PDF file with all the necessary information. So please become familiar with this. This website and how you access it. We'll eventually put the slide deck up from today and the recording as well as the fact sheet. So be familiar with this website. There we go. So there are some eligibility requirements for this RFP, and I'm not going to go through all of these because all of you good people can read, but we want you to be a community-based organization that has some experience working with community health workers and collaborating with other community-based organizations. We also want you to be in good standing with the city of Chicago. I'm sorry, is there a question? No, okay, I'm just getting feedback. So be in good standing with the city of Chicago. What does that mean? You have to not have any fines. You have to be up to date on all your income taxes and things like that. So all this information is in the RFP, but I just wanted to make sure we went over this. Okay. Very important to be eligible for this proposal because we are spanning over 2 years. The city has a fiscal year that ends December 31st and then starts again January 1st. So you'll be submitting 2 budgets. The amounts there are shown on the screen. So a 2024 budget and then a 2025 budget. And those need to be detailed budgets outlining what is salary, what is indirect cost, materials, operations, and things like that. So this is our available funding. So we have a little over $3.6 million for this RFP, and it runs through October 1st, 2024 through December 25th. And I know you're probably wondering, well, it's October 2nd. We ran into a little bit delays, but we are working in the best way that we can. So funding sources for this particular RFP is coming directly from the Chicago Department of Public Health corporate funds. And then we have grant funds from the American Plan Rescue Act funds. So there are two separate fundings that we're braiding into one. The American Rescue Act plans, those are the agencies that will be selected to receive that. They'll go through some federal guidelines and have to use, everyone will have to use the uniform guidelines when in preparing a budget. So let's get down to the meat of the program and what we're proposing to do and what we want to do out in the community. So we really, really want folks out in the community, and we want to help people access the programs in the community to help them live a long and healthy life. So what does that look like? What does that mean? So helping people access insurance so they can start going to doctors, helping people access federally funded programs so they have access to a telephone or they have access to a link card to provide food, things like that. We also want to make sure that there are various other programs, so resource navigation, so using in-person resource navigation, as well as we have a phone call center. There will be answering questions over the phone. So again, finding the resources in and around not only the community, but also city resources, state and federal resources that we can provide access to these folks. We also want to make sure there's also community events. We want to make sure that folks know what's happening in and around the community and provide education on specific things. So provide education on chronic diseases, whether it be diabetes, hypertension, sickle cell, cancer, things like that. So we are going to be attending community events. We want people to be canvassing the community with flyers and information on things that are happening. So that's the meat of the program. Well, not really the meat of it, but the outline of what's going to happen. So let me talk a little bit about the scopes of services here. And I know I'm going really fast, but I want to make sure you folks have time to ask questions. So we want the CBOs to hire and onboard these community health workers. We want them to manage the community health workers. So their daily activities, their schedule for works, and making sure they have the proper training. The City of Chicago would support these trainings, but we're going to focus on mental health and collaborating with some of the mental health clinics. We also want to collaborate with the federally qualified health centers in the area. So securing identification, there have been some barriers to receiving services because people don't have the proper identification. So these are the scope of services very quickly, but it is all written out in the RFP, and I encourage you to look at those. So the staffing requirements, we are anticipating funding up to 6 CBOs to employ up to 12 community health workers with 1 supervisor. Each of the community health workers' salaries and benefits are outlined in the RFP. All of the people who will be hired for this proposal must be 18 years of age or older. I promise I'm getting to questions. Okay, so we want to make sure that that each community-based organization that's awarded maintains staff who are competent and able to do the job, and that they also have the necessary tools to do the work that they're going to be that is going to be in the proposal. And these items, the tools for the job and the qualified staff must match in the budget. So if you're going to say every staff person gets, you know, an iPad, a computer, and a phone, then those things must be itemized in the budget and matched. I'm not saying they have to, I'm just giving an example. So everything is done online and electronically. No submissions are accepted hard copy. So make sure when you have your submission requirements that you have the project plan, the staffing plan, and the budget. Make sure that those 2-year budgets are in there. And then a demonstration of how you're aligning with the Chicago Department of Public Health principles. So fiscal capacity. So this in regards to payment, we want to make sure payment is done on a reimbursement scale. So we want to make sure that folks that these community-based organizations can pay out their community health workers and then submit an invoice for reimbursement to the city of Chicago. This should be done on a monthly basis, so you at least have the fiscal capacity to pay your community health workers upfront. It is possible that community-based organizations can use a fiscal agent. The necessary information is provided in the RFP if you're working through a fiscal agent. Insurance, right? We couldn't do anything without insurance. So attached on this slide here is the required insurance that has to be acquired and maintained throughout the course of the proposed grants period. So workers' compensation, commercial and general, automobile, professional liability, and cyber liability. Again, more information about this in the RFP. Reporting and other things that are necessary. So certainly if you want to get paid on a monthly basis, you need to submit those vouchers on a monthly basis. We will be collecting data on a monthly basis. We want to record what is happening and what is doing and look for opportunities to improve. We certainly want the feedback from all of these organizations and especially the community health workers. And then we are going to require that everyone participate in evaluation and quality assurance activities and site visits. This is a little bit of information about the e-procurement system. Oh, geez, I'm sorry, butchered that one. Just how to go about doing it. There is an online support, that customer support at cityofchicago.org. I encourage you to use that for any help or any information that you're needed. I am not familiar with it, and the customer support folks work with it every day and they manage it. So they're your best option if you're running into trouble. So this is our evaluation criteria. I want to make sure that everyone has this. We want to make sure that people are following our guiding principles. You know, we're really going to get into the meat of the evaluation criteria with the project description, the program work, the evaluation and data, your staffing plan, and your budget and justification, and your years of experience working with other community-based organizations. So that is the evaluation criteria. And again, it is in the RFP, so please refer back to that. Last, so this is our kind of our deadlines for questions is this Friday at 5 p.m. The proposal submittal date is October 25th at noon. If you have any submission questions, please reach out. Excuse me. And then if you are not on the e-procurement system or the iSupplier system, please allow 3 business days to complete your registration. So if you started that a few days ago, it should be done. If you haven't, I encourage you to start it now so you can get all of your information in. So I try to be quick. And with that, I want to open it up for questions. So I'm going to actually stop sharing so I can see all of you. And then I know questions should be in the chat. So if there are any questions in the chat, I will open that up and see what I can see. Okay, so Brian is going to help me with questions. I just want to make sure I get them all.
Yep, I believe Grant is the first question there.
Okay, Grant's question is, what communities are being targeted by this program? So we are targeting communities on the south and west sides of Chicago that have I want to make sure I say it right. Their life expectancy, there's a large life expectancy gap in these communities. I hope that answers your question, Grant.
Yes, thank you.
Mm-hmm. Okay, the next question is it possible to share in presenter mode? No, I'm sorry. But again, these slides will be available on online where you access the RFP proposal. These slides and the fact sheet will also be accessible to all of you. So Mike had asked, 3 years of working with community health workers, please define community health worker and working with. In other words, what qualifies a person as a community health worker in the eyes of COC, I think you mean Chicago Department on Public Health. And does our agency actually have to have CHWs on staff for 3 years, or could you be working with other agencies? So great question. Let's take that one at a time. 3 years with working community health workers. So there is a definition. There is a job description in your RFP of the definition of a community health worker. So I would encourage you to go to that, and I'm going to go to that right now. So I get it. And if my staff finds it before I do. Okay, a community health worker. So they don't necessarily, they could be people on your staff, but they don't have this title, but here's what they are doing. They are frontline workers who have a close understanding of the community that they serve. They serve as a link between health and social services and the community to facilitate access to services and resources to improve the quality and cultural competence of service delivery. So if you have people in your organization who are bringing direct service out in the community, so helping people access services or providing help to fill out applications or do something like that, that's what we mean by a community health worker. Okay, so if you're working with, was that if you have them on staff, it would, and I do believe it would include, and I don't want to say this right, but it may include volunteers if they are a registered volunteer for your organization. Okay, so define community health workers. Okay, I think we did that. Could you be working with other agencies, community health workers? Yes, as long as there was some sort of agreement, you're a part of a plan. It can't just be like we send our work to that agency to do it. So is there some sort of agreement or collaboration that is happening between the two organizations? Okay. Okay, our agency serves both people with intellectual and developmental disabilities and those with severe mental illnesses. Roughly 35% of the people with IDD also experience mental health challenges. Where our expertise in working with IDD community be something considered here? That's a great question. I would have to follow, I have to follow up on that. I don't know the answer to that unless one of my colleagues online does, but I will follow up on that. Can canvassing and outreach be conducted in schools? Yes, there are multiple ways to canvass. So when we say canvassing and outreach, we want to get the word out to the community. So sometimes that means dropping off flyers and putting them, getting them to the students, getting them home in their backpacks. Sometimes it means making sure the local library or churches have it. And then also sometimes it means is literally going door to door to people's doors and, putting it in their doors, a flyer or knocking on the door saying, hey, did you know that this is happening in our community? So there are multiple ways to canvass, and the type of canvassing will be directed. But yes to that. What type of documentation requirements for the work of the CHWs where they'll be? When you say documentation requirements, does that mean when you're hiring community health workers?
This is Chris. What I mean is, are there any kind of records of their work you're expecting there to be available? Like when you do an audit, for example, and what would that look like?
Oh, like if you've been working with community health workers for 3 years?
No, I mean, let's say I got the contract, I have the CHWs. What kind of documentation of their work would you be expecting, or if any?
Oh, okay. I think I know what you're saying. So we have something called after action reports. So after every time there is an activation or a deployment out in the community, we're going to want these community health workers to say, okay, I was out and I distributed 500 flyers and I dropped off 100 at the library, 100 at the school, and then I went from 1700 south on whatever street to 1800 south on whatever street. So they are documenting what they do so we can have that in our system.
Thank you.
And we have our medical director who just came in, and I feel like you want to add something.
No, I was gonna see if we wanted to, well, we could finish the questions and then maybe we can just try to address that question about like special expertise
Would you want to,
from our agencies. Do we want to?
you want to
Okay.
address it now?
We can try.
Okay.
Okay, so there's a question here from Mike. I popped in because I saw Mike's question about agencies like yours, Mike, that have special expertise with certain communities. So I think the fairest way, I'm going to try to answer this in the most agnostic way possible, which is that the RFP stands the way it is. And we invite all of our agencies, whether or not you have a specialized expertise or not, to please review the RFP. Essentially, we will be working with the agency to ask you to execute certain work on our behalf. As a CBO in this work, in this program, you'll be acting on behalf of the city. That's what a delegate agency does in these contracts. So we ask that you review the scope of services to ensure that the scope is something that your agency can fulfill. That being said, if your agency has the capacity to fulfill that scope and your expertise is with a certain community, we are going to consider all eligible applications, and we're going to take the highest scoring and best fit applications to serve the needs of these priority communities. And that may or may not include agencies that submit with specialized expertise. I think this is a two-way street. I ask that your agency review the scope of services because I think the most successful way forward is to ensure that you as a CBO have the ability to execute to the best that you understand the scope, what is written on paper. And that I think is the most fair way we can answer it. Is this is not limited to any type of agency other than what's written there, that we ask that you have those sort of background requirements. And we are really interested in seeing a very large application pool. We do want to make sure that we're working with the best possible agencies to do this work. So if you see yourselves in the scope of work, then we would love to see your application. Does that sound fair?
Yes.
Okay.
Thank you. And that was our medical director, Dr. John Tivitan.
Hi, thank you everyone for being here.
Okay. Second taste. When will the award decisions be shared? So the proposals are due October 25th at 12 p.m. Central Standard Time. So we are going to try to have a 2-week turnaround time. So we're going to try to take 2 weeks to review and then award. That is an approximate date. Are there any training certification requirements for the community health workers?
You'll have to be trained, but they're not.
So there's some onboarding training that we'll want everyone to receive, and we'll do that internally through the Department of Public Health. And there will be some outside trainings that we will also do, that those will be shared.
Kate, can you repeat that date that they will hear back one more time for everyone?
Sure. So the proposals are due October 25th by 12 p.m. Central Standard Time. We are hoping to have a 2-week turnaround where we review, and approximately 2-week turnaround time. Then we review and award. So I don't know that specific date because I don't have a calendar. First couple weeks in November.
So just so I know, the background says they have to have 3 years of CDPH experience. Okay, all right. So on that certification requirement, if your former experience in working with CHWs does not include CHWs who are trained in any particular methodology or certified, we will catch you up to speed. I just want to make that clear, that it doesn't, like the fact that we will support the training and making sure everyone is level set does not supersede the requirement to have pre-existing experience working with CHWs in that definition.
Thank you. Yeah. Can we subcontract some of the work with other CBOs? Yes, that is between you and the other CBOs. You can have subcontractors as long as it's written in the grant. I mean, in the budget. Sorry. Thank you.
And your application.
Yeah. Hospitals are generally able to hire people with criminal backgrounds. Does this mean hospitals cannot apply? It's got to be a 501c3 organization in the city of Chicago that
This is-
employs community health workers and has experience, correct?
This is Chris. In the RFP, it specifically states that you have to be willing to hire ex-felons, and that's just something a hospital can't do. Does that mean we're not eligible?
We saw the same thing and we're concerned about the same thing, Chris.
We will, can we get back to them on that one?
Yeah, I'm gonna have to, those are fantastic questions that our contracts person is not on the line right now. So in the fact sheet that is gonna be submitted along with this recording and deck of slides, I will make sure that question is answered.
The reason that I think we need to ask about that is that I don't know if it is a requirement that you are able to hire ex-felons or if that is essentially the scope of the program. So I don't know if it means that we have to exclude bidders who do not have that capacity. So let's find out for you.
Can you put that in the chat for me? Because I don't want to mess up the questions. So that one will be answered in the fact sheet. What are the intentions for spending the funds in 3 months? Can we roll over the funds if we don't spend them all by December? Great question. They cannot be rolled over. I would encourage folks to use some of that funding for capital expenses or items that you think you're going to need for 2025. Can community health workers be housed or work within schools for educational sessions, trauma prevention, and providing trauma-informed services? Like, do you mean on staff at the schools to provide trauma education? Is that the question?
Who wrote that question?
It's right here. Can CHWs be housed? Aaron, are you on the line?
I am, sorry, one moment.
We're just looking for clarification for your question.
So I had asked about canvassing within schools and conducting outreach within the schools. Can, say if we are housed or if some of our staff is housed in a school that does trauma-informed services, like they provide those types of services to the student population within different schools, is that possible or no?
So
I just want, wait, hang on, let me just like, I think the way I said.
So I don't think that we would exclude existing work that's being done in schools, but please refer to the scope of work. So if these community health workers have to be able to do the scope of work that is presented in the RFP.
It's not at the,
Understood. Thank you.
it's not at the exclusion of work, but if you're asking like, will this basically pay for existing work in schools? Please review the scope, because the scope is what we are going to ask the agencies to execute.
Right, I understand. We have our own CHWs. We were looking to just kind of cross over because we saw just the need in the schools that we serve on another team. So
Yeah. What I will say is I'll probably answer this the same way that I answered that question about, do you have special expertise? Again, this is not to, we want to see great applications. And I think there are going to be a lot of agencies that have like a special expertise working with certain populations in certain settings. This is probably not in the RFP, but I think programmatically, we will lean on our agencies to use their expertise in different ways. But at this particular moment, what we know we have to execute is what's in scope. So I think if this fits within your design and this is something you want to work with us on, please do apply. And then I think we'll just kind of see how your expertise could be leveraged. I think that's-
understood. Thank you.
Thank you.
So the next question is that the program awards only 6 organizations this time, and where could we find the previous awardees? So this is corporate funding. This is the first time we've had this corporate funding to fund community health workers. Previous funding was through grants. There was a previous RFP in 2020.
2020 and 2022.
2022.
We can get the old press releases.
We can get, I can, in the fact sheet, I can share the old press releases of who those awardees were. Wonder if some of the previous awardees renew their contracts with the city and if there's actually less new awardees here. So all of the contract, there's no more extensions. So that RFP, you can only extend an RFP for so long and then you have to reissue an RFP. So this is a reissue and a reorganization of the RFP that was done in 2022. So we have different funding, there's different objectives. We're not smack dab in the middle of COVID anymore. So we are going to be starting fresh with all new community-based organizations.
Yes, there's no more renewal of contracts on the prior RFPs, but your question about are there fewer awardees than previous? In a sense, well, it depends on how you look at it. This is a new mechanism for doing this work. If you are comparing COVID, the COVID vaccine core or the prior iteration of the community health response core, it will be in effect fewer awardees because the size of the funding has gone down, not because there are rollover contracts. All contracts are ending.
Yes, good point. Thank you. The next information in the chat is not a question. So do I say that out loud? Okay. So this organization is a national healthcare staffing organization with a significant local presence in Chicago, and they have a large network of local community health workers. They are interested in discussing potential teaming partnership as a subcontractor. Please contact if you're interested. Amerigus Healthcare Staffing, formerly Maxim, Chris Remley. And his information is in the chat, and I will make sure that gets in the fact sheet. It's not mentioned in the scope of work, but will community health workers be 100% responsible for only Chicago Department of Public Health focus areas, or can the organization set up a certain percentage of hours to focus on local priority areas that are aligned with healthy Chicago priorities?
I think that's a great question.
That is a great question.
I don't know.
Yeah, we discussed this.
How about we take that one offline, Priyanka, because that's a really good question. And I don't think we have solidified an answer for that. Yeah, how about we solidify an answer for that?
Yeah, we'll
And
have
put it
to
in
follow
the-
up on that. Can you put that? We'll follow up on the fact sheet on that. Thank you. Great question. Can you repeat the date again? So the proposal is due October 25th at 12 p.m. noon. I'm hoping that's what the date you were. Are potential subcontractors also required to be 501c3 organizations?
No, this is Bernice. Not per
Thank
the
you.
RFP requirements. What we require is that the lead organization be that.
Thank you, Bernice. So no, the lead organization has to be a 501c3. The subcontractors do not. It sounds like Chicago Department of Public Health would be generally directing the work of the community health workers in terms of what kind of activities you'd want them to do. And the CBOs would just be the ones hiring, training, supervising. Is this the case? Or would the CBOs be directing their specific work activities? So I think it's a combination, because some of the work that the community-based organizations are doing is some of the work that we want to promote out in the community.
The team you see here is almost the extent of the team. So this is delegated services because we ask for the CBO will be the one conducting the work. I think what folks are getting at is like how, like, where's the balance of CDPH's, like what are the activities we're going to ask you to perform and how many is this sort of self-created? I agree. I think this is going to be a little bit of a balance. CDPH knows that there's certain activities we do want to see executed through this, but I think in all reality, the way the core has functioned in its previous iterations is that we rely on the CBOs and their expertise to be able to tell us what is important in their neighborhoods and direct the work in, key areas, make sure that the work is relevant. We provide a lot of sort of level setting, priority setting, strategy, oversight. Like we provide prioritization. We say this is what's important right now based on data, departmental strategy, departmental prioritization. We have some instances where there's work that we will say we want this done. But I think the rest of it is a real partnership.
Absolutely.
Right. And to keep in mind, it is required that you submit a work plan. And that work plan for the awardee will be worked with CDPH and receive final approval. And this is where all of this goal setting priorities and objectives all come into play. So there'll be one work plan agreed upon by CDPH and the final awardee.
I think Priyanka's earlier question hits at this too, about like how much of it is CDPH directed and how much of this is up to the agency. We'll get back to you on the geographic areas because I don't know that we have a firm answer on that, but we have been practicing this model in the prior iterations of the core. And I would say at least for the activities, it has been a balance. Do you think I'm right on that?
I think so.
Okay.
Yeah. I mean, we're all moving towards the same goal. We want to help people live healthier lives, and we all do that in different ways. And how do we take the experience and the knowledge that the Department on Health has, and how do we transfer that on to the community health workers who can then share it with the folks living in the community? So another question, is the community health worker model replacing the trauma-informed centers of the CARE initiative? I don't know what the trauma-informed centers of the CARE initiative, I'm not familiar with that. So Michelle, if you want to.
We're not replacing it.
Okay, yeah, I'm from the YWCA and we're funded under CDPH for trauma-informed centers of care. And so I was trying to get clarification based on the comment that you made about contracts all ending and then this will be new contracts.
Oh,
So.
no, we meant ours. We have a 2022 through 2024 contract under the name and scope of Community Health Response Corps that is ending. I apologize for the
Got
confusion.
it. Okay. All right. That's helpful. Thank you.
Yeah, so we are not replacing the trauma-informed centers of the CARE initiative.
We're replacing our own model.
Is the community CRC, Community Response Corps RFP expected to continue after the 2025 contract? So there are 2 extensions in the RFP.
We're current contract.
Goes until the end of 2025.
Yes.
So
Do
there
you
would
want to
be,
explain how that will work? I think we should explain how that will work.
so, well, we explained that there are 2 budgets. So you
Mhm.
have to submit a 20, and it was in the RFP and also on the deck, the dollar amount for 2024 that has to be spent by the end of 2024, and then a dollar amount that has to be spent in 2025. And then we can extend those contracts 2 more times per the RFP. I don't know how.
Yeah. 2024, which ends December 31st of 2025, and that cannot be rolled over. 2025, and then the extensions are 2026
To
to
2027, 12/31/2027. Per nothing changes with the city.
I was gonna say, so we have in here the source of funding, right?
Yes,
Did we state the source?
we did. We talked about that
Okay.
it's corporate money from the Chicago Department of Public Health, and then it's ARPA funding,
Yeah.
American Recovery.
So corporate funding is from the city of Chicago, so we cannot, I mean, we really can't on this call make any further like claims about what that will look like, but you know, we hope the program continues to succeed.
Okay. Are there any more questions? I don't, that, look at that.
There's also one that relates back to the question case.
Hi, Jerome.
Jerome, if you can, I'm happy to have you state your question, but I also need to put it in the chat, please.
Yeah, I'll be happy to put in the chat. I just wasn't typing fast enough. I didn't want things to end. So I'll type it as soon as I go. My question was for the purpose of like planning activities for the grant. Because I'm familiar with like the COVID for the grant that came out for COVID contact tracers and case investigators, where there were certain activities such as trainings, meetings, and other things that the participants were, the employees were responsible for participating in. Will those things be occurring as well? Like certain times they'll have to dedicate towards training during work hours that we would need to consider when mapping out the activities that we propose in our plan.
So great question. Thank you, Jerome. So the question is just to make sure everyone heard it. Will there be times when you're doing your programming that the community health workers will have to attend trainings and attend meetings? And the answer is yes. We want to make sure that they have regular educational opportunities. Things are going to come up in the community that we want to make sure that they have the right tools in order to present the information out into the community. And we also want to make sure we're meeting with the community health workers on a regular basis to get their feedback and to know what's needed in the community and make sure we can provide those needs. So thank you. So what happens next? If there are any more questions, I don't want anyone to be trying to feverishly type in the chat. Again, as long as you can get the question in the chat, I'm happy to answer it here live. And if you don't have a question, that's okay too, because we just threw a lot of information out at everyone. You do have until Friday, October 4th at 5 p.m. Central Standard Time to submit a question. So if you kind of take this back, talk with your staff, go back and say, hey, I forgot about this. Get those in by Friday, and those will all go out in the fact sheet. So this deck of slides, this recording, and then the fact sheets of all these questions that we talked about will also be put in the chat. Oh, George, will there be an earn and learn component? So with the previous grant, there was an opportunity to earn and learn. So what that was, some of the hours per week were dedicated to workforce development. So earning something. Not this time around. We were fortunate to have during COVID a healthy amount of funding, and we don't have as much funding. So there will not be an earn and learn component this time around. Jerome, thank you for putting your question in the chat. Good questions by all. So if there are no more questions at this moment, we are all, oh, there's one more.
Yeah, there was one more about, was it not?
That was about the earn and learn.
No.
And that was Jerome. He typed his question.
Oh,
in the
okay.
chat, So we talked about that. We're concerned about not being able to meet this requirement during the duration of this contract. Each CBO will reach 800 community members through community events, direct engagement, spoken to about a health topic or a resource, fill out forms, secure identification, and inbound and outbound calls. How will CDPH help us reach this number?
And I was just typing it really, really quick, but more than help, like if we're getting to like 6 months, 9 months, and we realize we're not going to get to the 800, will there be a discussion with CDPH? How will we be able to manage that if that's a number that we're concerned about hitting?
Sure, great. Mike, great question. Thank you. So that's why filling out those after action reports are very important. So, and we'll be asking each CBO to submit monthly reports. So we're going to keep an eye on those numbers. So we'll have monthly reports, and then we'll do quarterly reports, and we'll say, hey, what's happening? Things also pop up in the city, right? This summer there was a measles outbreak, and we had to deploy a lot of people to get that information out. The city has a lot of priorities. There's a lot of new mental health clinics that are popping up, and we want to make sure that people in the community know about this stuff. So if those numbers are not where they should be, you'll definitely have our support to figure out how can we reach those numbers. And I should say those numbers are for the duration of the grant. So we don't want you trying to reach 800 people by the end of this year. We know that that's not feasible, but for the duration from October 1st to December 31st of 2025, that's where we're seeing that number is.
Could you give that date range again? I'm so sorry.
October 1st, 2024, which I know we're past, but that was the duration of it, to December 31st, 2025.
Thank you. And thank you all. This has been really informative. I just want to make sure that's been said. This has been an excellent webinar. Thank you.
Well, thank you. One more question from Bailey. Is there a certain due date for sending those extensions? Yes. And when the time comes, we will share those due dates. So everything has a due date. But let's get to the proposals and the awardees, and then we will certainly share those due dates in enough time.
Extensions for the application or for the funding?
Well, good point. Extension for the application or extension for the funding? Can you clarify your question? Funding, yes. So there will be due dates, and when we reach that time, or actually a good amount of time before we reach it, we'll share those due dates.
Those would be issued, just for clarification, if you're talking about extensions into 2026, yeah, we would be issuing those in 2025.
Okay, and I want to make sure I and Brian are helping with questions. I didn't miss any questions, did I?
I believe we're up to date.
Okay, all right. So that concludes this bidders conference. If there are no more questions, that concludes it. And again, you have until Friday to ask a question. So my email is on the RFP, and Brian, can you put my email in the chat one more time?
Yeah.
So you can email me those questions and we'll make sure we'll get the fact sheet out. All right, thanks all. Have a great day, and I look forward to those proposals. Bye-bye.